Hi, I'm Rob Arnaud, and I'm here with Dr. Yonner. I had the misfortune, I guess, as we all get older, to have two bad knees. One went down with a torn meniscus, had surgery, and it failed. And consequently, I'd made an appointment to have a complete knee replaced this winter. In the meantime, I had two friends that were associated with Dr. Yonner, and they educated me about the shots. And through the course of last year, I put so much pressure on my right leg, I actually blew my left one out on my meniscus. So I thought, what the heck, I'll try it. But I thought, first I'm going to go talk to the doctor. So I went and talked to the orthopedic surgeon. The surgeon said, well, really the science isn't there. A little hesitant, but still okay with it. And then in the next breath said, we're considering selling it also.
And they also said it's expensive, right?
And they said it was expensive.
Yeah.
And so I thought, got it. So I went down here to Dr. Spence, and he had a doctor come in and give me a shot in my left leg. And in the meantime, I was scheduled for a knee replacement a month later on the different leg.
Okay, on the other one.
On my other leg. Thank you.
Yep.
And so I had a unique a chance to say I have on one leg and a replacement in the other. And there was pain associated with it. And then it was within the second month, it was beginning to diminish. And by the end of 2 months, it was as if it was shut off. Gone.
The pain was gone.
And I went into the orthopedic surgeon. I'd actually had the other surgery done, had a replacement. And I said, what about my next one? Check it out. And they could not get me to say ouch with my torn meniscus.
So you went in for the scheduled knee replacement on the other knee.
Got it done.
But when they were trying to test the other bad knee, it was no longer bad.
It was no longer bad.
And what percent would you say you're at right now with that?
Honestly, I think I'm about 85% of where normal is. Enough that I feel like maneuver, hike, crawl around, do the things I like to do. And honestly, I will come back next fall and probably get another one, or next winter.
And what would you say your experience now that you've had replacement on one knee?
That's a very invasive surgery, and compared with getting a shot, I wish I'd have had the patience and had it done in my other leg. My left one with the shot had such good results.